Hey Ben, so this is the material that we're about to inject in my knee, and we're also going to use a little bit in my great toe that has a little bit of arthritis. So what we're looking at here on the two syringes with the gold colored material, that's a bone marrow extract which contains stem cells. And then the red there are, that's platelet rich plasma that is also going to be injected in my knee. And right now they're just looking at the scans, and then they're going to do a ultrasound guided injections into my knee. I'll shoot a little video of it, so if you're curious you can see how this is done. But to my knowledge, I'm one of the first people, maybe the very first person, to have a confirmed fully ruptured ACL repaired this way instead of surgery. And you might find this funny, but while I was waiting here for them to finish spinning this stuff out, I was actually doing some ATG stuff in my waiting area here. So this is the knee we're about to fix, and I'll keep you posted, but it's interesting to be in touch, and look forward to communicating with you further. Unless one of you guys wants to record.
All right, so here's the tibia, and now we see the, right there we see the patellar tendon. And nothing exciting yet. I gotta find the target yet. We're gonna go off of there. Now there, we know we see a groove down there. Way down below, right there is the ACL. It's surrounded by other tissues right there. It's moving off to the side. So it's right down there. Right there. See, it's right there in that little groove. That round thing, yeah. And when there's an acute injury, then there's a fusion around it, and then it lights up. You know, it's just, you see a circle. But right now, we don't see the circle because it's not an acute injury. So, okay, I'm ready for the.
So for people that
see it, see that little thing right there. Yeah.
For people watching, we're doing a stem cell treatment on a blown up knee with Dr. Marco Boder at the Boder Clinic.
Very precisely insert.
And one of the things that makes Dr. Boder so special is his ability to visualize these structures with the ultrasound and guide the needle exactly where it needs to be. There's a lot of people that do this, but there's nobody that does it like this. This will be the second time I'm repairing this knee with stem cells. I ruptured my ACL a couple of years ago.
In the video mode, capture. You can see there's a needle that's heading for the ACL. And we just entered it right now. Okay.
And now we're doing PRP, which is platelet-rich plasma.
PRP mixed with the BMEC. We mix them together. Injecting right around in the ACL. And it feels like firm because I'm right in it. There's firm.
Surprisingly, this doesn't really hurt.
Of course, Oliver, as a former professional mountain bike racer, is used to pushing his body to the limits, even beyond pain. So he's used to that kind of area. This is very solid in here. You can feel that. And you can see as I pull out of the ACL right here, now we get some more flow right there. Now we're outside the ACL. And then I go back in it right here. Right there. And then we're going to put the rest around it. And then we're going to follow it up a little more. And you know, the ACL has its own sheath. Okay, and so now we're right outside the ACL. I see the ACL is right underneath. Okay, now we're going to put the rest of it from the other side. Thank you, gentlemen, and I'll have you put a little Band-Aid over here.
Would you mind to videotape this? The
Sure.
rest we'll do a pause.
The lateral part of the knee from the posterior it's got more of the dangerous things to avoid. So the peroneal nerve is lateral, and the tibial nerve is right around here.
Mm-hmm.
It's gonna be right around here. And he's thin enough that we could probably see everything with the 12.5. Let's go ahead and switch to 12.5.
Are we doing anything to the meniscus today, since it seems to be in so many pieces now?
Yep, we will.
Amazing.
So let's just see if we can see it. Okay, so then this starts to wander off. So we're going to angle like this and like this. You can just stop the recording for just a sec.
On here?
Yeah, stop. You can just stop and then demonstrate. Okay, so we are seeing a video screen here. The needle is a diagonal coming from the top right of the screen, and the ACL, we've already put a little some cells in there, which makes it light up light right here. That's the ACL. This is the femoral notch. Very good. And that's what we're seeing right there. Putting some right around it now. And in it. I'm going to save a little bit for the metaplatysmal ligament. That's it. So what you guys will see here is a very bright white thing. That's the tip of the needle. The tip of the needle is now heading for a cleavage tear, and actually we just let loose some of the BMAC into the tear. It's heading right for that. And there we go. Filling it in. That's it. Now we're going to go to the lateral meniscus. There's a needle. And there, right there, you can see it's right inside the crack, inside the black area. The meniscus, there it is, right inside the black area. Now we switch syringes. The needle's in perfect position. I'm going to use the other one. Yeah, this one. Okay. All right. Go ahead and record that. This is flowing in. Got plugged up. So that's good. It's clouding nicely. I need to switch to a little bigger needle, 25 gauge, the blue one. Recording. And now flowing in. Look at that. There we go. And we just lost a little bit because it was a little backup in pressure. That means it's filling in. We have a little more left. That's it. All done.